Okay, so now I'm going to encourage you to think differently about health. And we'll start with the World Health Organization's definition of health. This is the first five parts of their constitution. Health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. And that's a very aspirational goal. It's a little bit vague. Complete mental well-being. When was the last day you had where you could describe your social and mental well-being as completely healthy? I mean, and physical health. So, it's a lofty goal. Um, it has been modified by other scholars, but that is one way to think of health, and it does incorporate all aspects of the human or most aspects of the human being. So then the World Health Organization goes on to say that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. And that is a brave statement. Um, Now, whether implicit biases that people within the World Health Organization hold create barriers to that, that could be a discussion board post someday, maybe. But the World Health Organization has stated that this is a fundamental right. The health of all peoples is fundamental to the attainment of peace and security and is dependent on the fullest cooperations of individuals and states. So, here what they're saying is that if you want a peaceful, prosperous world without terrorism, without the threat of violence, without the threat of climate change and all of that, we all need to work together. And there's no such thing as a problem happening in one part of the world that does not affect you in some other part of the world. And so we need to work together. All of humanity needs to work towards this goal of health. The next statement is that the achievement of any state in the promotion and protection of health is of value to all. So again, no nation is, complete unto itself. If we have health in the global south, in Africa and South America, we have a better world in general, and we all benefit from that. Unequal development in different countries and the promotion of health and control of diseases, especially communicable disease, is a common danger. Um, and so, what it's saying is global health affects personal health, community health, national health. Um, no such thing as one part of the world that doesn't affect all the rest of the world. So, that is part of the Constitution. That's one way to think about health and healthcare. The next concept I want to talk about is upstream thinking. Okay, so there are a lot of versions of the story that sparked the term upstream thinking. One of them is really horrible, but I'll tell it anyway. Why not? There were some people, and they were enjoying the river bank, and they noticed a baby floating in the water. Well, they go in the water and they rescue the baby. And then they start to notice another baby in the water. And then soon the water is full of babies, and they're going in and they're trying to rescue them all. Some of them are drowning, and there's overwhelming number of babies in the river. And somebody says, how are all these babies getting in the river? I'm going to travel upstream and find out why this is happening. So that's what upstream thinking is. And then, he finds a bridge that's broken and the strollers slip through it or whatever. There are other versions of that story that just use drowning people. But I don't know, I get a kick out of the drowning babies because I'm sick. Anyway, upstream thinking refers to the idea of looking beyond the current problem to address its root cause and addressing that cause. And upstream thinking leads to effective, sustainable solutions. If you are always reacting and responding, if you're always jumping into that river and then you're pulling people out and you're doing CPR, you're going to burn out. You're going to get exhausted, and there's still going to be a lot of drowning babies because you haven't fixed the cause. And that's what's happening in healthcare, in medicine, in nursing, in the other disciplines, is that we're all trying to rescue one patient at a time. And we're not looking at those upstream causes, or at least many of us aren't, and we're burning out. We're getting fatigued because we can't rescue them all, and it seems overwhelming. It seems like a problem we can't solve. So change your thinking to upstream thinking at least some of the time. And we're going to talk about sustainable development goals. These are 17 goals that are set by the World Health Organization to promote global health. They include things like clean water, clean air, uh, education of women. I actually posted some resources that are, short video, 2 minutes and 12 seconds, and one article. I'd like you to read it because I don't feel that I can say it better. And I'm certainly not going to drone on for all 17 goals. You can see that information. It will be much more clear and much more concise for you. And we need to talk about those social determinants of health that I've been talking about this whole time. These are non-medical factors. They're not your genetics. They're not, an injury that happens. These are factors that are not medical and that impact health. So I gave you the little graphic to the left of this slide. They include things like the health policy, the social policy, law. How does our justice system work? How does the justice system in the People's Republic of Myanmar work? And how does that impact the health of those individuals living there? How much surveillance are you doing? If you're not tracking your maternal mortality, how do you know what the problems are? Evaluation, evidence building, infrastructure, community engagement, these are all parts of social determinants of health. They include all the conditions where people are born, grow, work, live, age, and eventually die. And they include broader forces like culture, racism, gender roles, economic stability, all of those things. Adverse childhood experience is not on the list, but it is certainly a broader force. These are kind of the things that determine your health that aren't determined by genetics or other medical conditions. Levels of prevention. Wow, this slide looks a little wacky. I'm going to have to fix it for you, but I'm just going to keep talking anyway. Hope it doesn't bother you too much. There are actually 4 levels of prevention. I'm going to give you the first 3. Now, you probably get this in community health. You probably got it this week. Primary prevention targets disease before it develops. That's when we start talking to every child in middle school about eating according to my plate, or we subsidize vaccines for every child. When we encourage lifestyle modification for all adults, you put labels on cigarette packs, or you discourage other unhealthy behaviors. We try to get people exercising. That's primary prevention. Secondary prevention is when we detect disease early, we have surveillance programs to screen for things, and then we can treat them while those conditions are still manageable. We can give those people longer life expectancy. We can give them a higher quality of life if we don't wait until they look sick to treat them. So an example of this could be the newborn screening program. It's in the United States, but it's also worldwide. In most countries, there is some form of newborn screening, where we can find out that an infant was born with a genetic disorder, and we could target them for treatment before they show irreversible damage. Tertiary prevention is what we're most familiar with. When you go to clinical, we put you in hospitals, which are acute care facilities that treat illness after the symptoms appear. And that's done to prevent further damage or relieve symptoms. So that's your primary, secondary, and tertiary. You're going to get it again in community if you haven't already had it. Now let's talk about the last one. Well, it was really the first one. Primordial prevention. What is that? That's a new concept, right? Usually don't hear that. Usually we hear about primary, secondary, tertiary, and they kind of drill it into you. Primordial refers to changing social and economic policies and climate to address the social determinants of health before they create the risk of illness or injury or premature death. Primordial prevention should really be a lot of our focus is. And I know you're not in nursing school to become a politician, but be involved in that process and be aware of what's going on in health policy, both domestically and around the world, and, be part of it. Okay, and the last thing I'm going to talk about, and then we are done, except for the other little things in the module, you'll have to do your discussion boards and etc. The Mercy experience and global health. So I know you guys have heard all about Catherine McCauley and, the Mercy critical concerns, the Mercy values. Mercy has a very large and thriving healthcare ministry. The first slide in key players was the Mercy ship that is a floating hospital, but they have facilities in Belize, Guam, Haiti. I know they've done work in Haiti. They've done work in Ireland. They've done work in the Philippines, and they do a lot of work in the United States. And because the critical concerns deal with a lot of those social determinants of health, we have nonviolence and immigration and justice and women and racism as part of those critical concerns. And all of those things make a difference when it comes to global health. So the presence of Mercy and other organizations really can't be understated. And you should be really proud to be affiliated with a community that really does value those things. All right. Thank you. And good luck this week. If you have any questions, please let me know. I am available, email, telephone, in person, wherever you might need me. Thanks.